Today, we are going to be doing herpes simplex and how to live with it, how to cope with it. So, herpes, very common infection, viral infection with two main types, oral and genital herpes. Um, and this can be other versions as well, but these are the main types that are quite prevalent around the world. As you know, familiar, the blisters, the lesions on the mouth can break down completely. But in the beginning, there might just be some tingling or swelling. But the classic herpes lesions are these little blisters that you can see. The problem with herpes is that once you get it through skin infection from the skin, it gets into the nerves, and the nerves, it stays in the nervous system and it can reactivate. So the antiviral treatment that you take will clear the skin, but it can't get into the nervous system and clear the nervous system, unfortunately. So it will lie dormant and then reactivate, lie dormant and reactivate, and this is the issue. That's why it's called the gift that keeps on giving. So that's herpes. Just a broad view. Now, according to the WHO, they have the same sort of level of statistics, around about two-thirds the world population have the oral form of that exposure. And they're quite high numbers for the genital infection as well, 30 to 40% is the estimate. So this is quite a common condition. The way it's spread is through direct contact with the active lesion or with fluids, obviously sexual transmission, kissing, um, is the main thing. So obviously prevention, you're looking at using barrier methods or abstinence. Abstinence works. But once you're infected, then viral shedding can occur even if it's asymptomatic. Even if it's asymptomatic. So if one gets skin lesions and you're not sure, there are a variety of lab tests one can do, but none of them really are practical for general testing. So clinical diagnosis, in other words, your doctor will tell you, and based on its behavior and response to antiviral therapy and exclusion of other similar, then a diagnosis would be made. Pregnancy is an important consideration, and of course, discuss with the OB/GYN, your obstetrician, because there are a lot of issues. So, just for example, so this isn't regarded as medical advice. Every patient, every person is an individual. You need to discuss your own individual um, situation with your own medical doctor. Like, but to give you some idea, that you'd have to reduce transmission in some way during delivery. So what's been forwarded is a cesarean section is the best way to reduce exposure to the child. But there are other things that can be tried. For example, the use of antiviral therapies given in the last month, especially acyclovir, which might reduce the risk, but not to zero. Treatment. There are some antivirals, they work reasonably well. Uh, Acyclovir been the own mainstay, but there's valacyclovir and famciclovir and others. These are more longer acting, so they're simpler to take. You need to take less of them over a period of time to have the same effect per day. So you're looking at least 10 days treatment and clearance of the lesion. So obviously, if one's immunocompromised, it might take a bit longer, make one more susceptible to shedding. So what it brings us to is really the key part of the talk, which is how do you live with this story? You know it's recurrent, you know you might be shedding. Um, so barrier prevention of transmission to your partner obviously is important. So open discussion and disclosure in the relationship, use of barrier um, methods for uh, intercourse, abstinence, of course. Managing pregnancy, you need to talk to your OBGYN for management early and let him know as early as possible that you do have this problem, or if you have lesions that develop during pregnancy, always make sure you advise your OBGYN so that you guys can make a plan, um, which might include planning a cesarean section or not. Okay, so pregnancy is a special section, prevention, discussion and disclosure, those are important factors. In terms of treatment, so your approach could be wait for an episode and treat each episode. So expectant management is one way. Another way related to that is often there's a prodrome or an initial symptom, such as swelling or tingling, that you will know in that particular area. You know it will come in that area. So when you have the symptoms early, what you could do then is keep some of this medication, acyclovir, valacyclovir, for example, famciclovir. And when you get the symptoms, start the treatment and do a course to prevent the full lesions from developing. So that should shorten the course of your viral attack. You could also use this to plan. So say you have an important event coming up, whatever that might be, and you don't want to have a breakout during that period, what you can do is for that period, take a course of antiviral treatment while starting a couple of days before and then through the episode or through the meeting, the event, um, on an as needed basis. Okay. So if you have early symptoms, tingling, swelling, bit of redness, starting early treatment, that must help you quite a bit from getting the full-blown skin lesions and breakdown. Planning for particular special events in your life. You can take a course in advance, starting 1 or 2 days in advance and then continuing. The last method is an interesting one is suppressive therapy for a long period of time, say for 1 to 2 years of continuous treatment using this medication. So obviously, as with any drug, when you take it, there may be side effects and you may have particular individual problems. So always discuss these with your own personal health caregiver to make up your own personal plan. Okay, this talk is just about general issues that you can raise with your healthcare provider. It's not specific medical advice. But you can choose suppressive therapy for a year or two and then stop or continue depending on um, your discussion with the healthcare provider. Or you can wait for early symptoms and treat that and then just manage events, special events. treat on an as-needed basis, but early. Or you could just wait for the full-blown lesions and treat them. So over your lifetime, you can expect um, the episodes. Usually, they reduce in frequency and severity, and they become more manageable as time goes by. And of course, there may be treatment that can clear out the nervous system in the future, so there may still be future breakthroughs that might assist. Thank you very much for your attention.